Let's talk about
mental health.
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 Mental health during Covid-19. It has been predicted that Covid-19
is a pandemic which could have a profound effect on people's mental health. It has also been argued that the coronavirus is fertile ground for those with any mental health conditions.
What is mental health?
Mental health is a state of well-being in which an individual realises his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make a contribution to his or her community.
What is the coronavirus?
Coronavirus is a new illness that affects your lungs and airways, with the main symptoms of a high temperature and a new continuous cough.
So I decided to ask the people being affected by this in the UK to then gain an insight as to whether Covid-19 has or will have an effect on the nation's mental health. Has Covid-19 affected your mental health? If yes, did you struggle with this previously?
Covid-19 has affected my mental health. Reason being is because I feel like all normality has gone. Yes, I have suffered with mental health for a long time. It's not helped whatsoever, especially when it comes to germs, viruses. It's really set my anxiety off.
My mental health hasn't been too bad because I think there's a lot of other people in far worse predicaments than mine.
I do think that Covid-19 has had a negative impact on my mental health, but yes, I did struggle with mental health issues before.
Yes and yes. I had some long struggles up and down mental health over the entire course of my life. I suffer from something called thanatophobia.
I do have some mental health issues. There are some days I obviously struggle, other days I'm my usual cheerful self.
Yes, Covid-19 has affected my mental health, and I have suffered with depression and anxiety for a number of years now due to various medical issues.
So Covid-19 really hasn't affected my mental health in any way. I do suffer from mental health issues, however, staying indoors, self-isolating, it just kind of feels natural to me. I feel more comfortable doing my work here.
I definitely think coronavirus has impacted my health in a negative way. I already struggle with an anxiety disorder, but this is more triggered by situations I feel trapped in. For example, going to a meeting with a lecturer or kind of like to a pub with friends, but I feel myself struggling with my anxiety on a day-to-day basis just sat in my house.
Whilst I didn't struggle previously, I do find with lockdown, I do.
Someone with ADD, attention deficit disorder, being told to stay in for a very long time is a very difficult situation to deal with.
Yes, it has, but I never really struggled with mental health in the past.
I think Covid-19's affected my mental health in probably social aspects.
I don't suffer with mental health issues generally, but the coronavirus has affected my mental health and way of living ever so slightly.
I'd say that Covid-19 has affected my mental health, as I'm working at the hospital at the moment on the front line with it all. I've never suffered with mental health before.
Yeah, it has. I did struggle previously. I get good days, bad days. I have mood swings. But to be told you can't go out, or fearful when you do go out.
How has Covid-19 affected your mental health?
It's made me more anxious, it's made me feel a lot more depressed.
I have 4 or 5 days where I'm just kind of getting on with it, and I think things could be a lot worse, and then I'll have the odd day where I get quite depressed and I get quite down.
It's affected my mental health mainly due to the feeling of being trapped, not having any structure to the day. Normally I'm able to get around my mental health by having distractions and being able to get out and see people.
For me, it's been a real regression back to the sort of angst that I had when I was 14, 15, mixed with this weird adult sort of depression I had. I won't call it depression because I'm not officially diagnosed.
I also work in Southend A&E. I am a receptionist and ward clerk, So as a part of my role, I meet and greet patients, and some of these patients could be confirmed COVID or those coming in with COVID related symptoms if anyone in my family got ill with it, because I would automatically think it'd be my fault that they've contracted it. I obviously know that there's other ways of contracting it. When we go shopping, we're obviously social distancing, but I would automatically feel like it'd be my fault. And obviously that puts a lot of strain on me, but a lot of strain on my mental health.
Yeah, it increased my anxiety, as I say. I feel really concerned about family and friends all the time, especially my parents.
Even though it hasn't affected me, COVID-19 really, it's shown that we need to implement some support groups for people who have, for people's mental health who has worsened over this pandemic, and also give support to people who have not realised they suffer from mental health.
I feel like I'm not being able to keep up with tasks that I would previously, even though I technically have more time to do uni work because I'm trapped in my house. Because I'm feeling so anxious and on edge all the time, it's making me really struggle with keeping up with my uni work. I also think leaving the house is becoming more of a struggle.
I haven't seen anyone, although my daughter is very good next door. I see her over the fence. I miss my friends, and I find it very hard being, well, really stuck in a house and garden, even though the garden's lovely. It's
been actually rather difficult. As someone with ADD, not doing something for very long really does start to affect you. You get these sort of cravings to do something stupid and then you just do it.
I think COVID has affected my mental health slightly, especially with how it's affected my workplace, which has made me very stressed.
The fact that I've got to work from home and not obviously socialise with people, I guess that's probably having a bit of an impact on my mental health currently.
I contracted symptoms of the coronavirus and I had to self-isolate for a week, but because of that time it pushed me back with university assignments. I'm currently way behind and I'm currently playing catch up. So because of these symptoms and because of how I was feeling, I couldn't do any of the stuff I wanted to do for university at all. So I'm currently stressed. Now, stress is a mental health issue. It's not a major mental health issue, but it's definitely one of them.
I find it hard going to work and then coming home, not being able to see my family and friends like I usually do, or being able to help my disabled auntie that I help quite a lot. It's just made me a bit depressed, and it's emotionally and mentally draining at work.
I have restless nights, I can't sleep, I'm tired when I'm downstairs. When I get to bed, I can't, my mind keeps going over stuff that's from the past, what I could have done differently. And then I'm watching the news constantly. I was up all night watching the news at the beginning.
Do you have any tips to cope better mentally during this pandemic?
Keep speaking, try and keep a routine, as routine's key.
Any tips during this pandemic? I would say try and keep yourself active, which is advice I'm not actually following myself. But one thing I do think that's helping me is trying to stay really creative.
Having some structure to the day, as if it was a normal day, getting up at a certain time.
I would, if you're creative, write, make some short films, do YouTube, live stream on Twitch, anything that's going to really fire up your brain.
I found a couple of ways that helped me cope during this pandemic. One of the ways is that I don't stay up to date with the news. I don't regularly watch it, so I don't keep up to date with the statistics on the amount of people that are dying, and then of those percentages, the ones that are key workers, because it doesn't help my mental health.
Try and find a hobby. Try and find something that gives you a focus, something to take your mind off of what's happening.
Just try to be as productive as you possibly can. Try and be as creative as you can.
Don't read all the news articles on Facebook and Twitter. They're not healthy, they're not helpful, and quite frankly, they don't know what they're talking about. I think the problem is with most of the news articles is they're guessing. I would also say coping mentally, don't compare yourself to other people. I think it's easy to go on social media and Instagram and see, oh wow, their to-do list is this for the day, they've got this done, it's 10 AM and they've been for a workout and I've just woken up. I think comparing yourself to others isn't helpful. You've got to do what's best for you in the pandemic.
I find I don't always watch the news because it upsets me, quite honestly, and I get depressed with that. Try and smile and just think, hopefully this will all be over soon.
Follow the guidelines. They're there to help us, they're not there to make things difficult.
I think just try and keep calm and know that everyone's going through the same thing together. Try and keep contact with friends and family so you don't feel alone as well.
I would probably suggest, you know, as I say, keeping fit, doing regular exercise, socialising with friends via video call.
My advice is to keep busy, keep active, do your daily exercise.
Find a hobby you can do indoors, go out for walks and runs, make sure you speak to your family and friends every day.
Do things you like. Do things that make you happy.
Do you think the repercussions of COVID-19 will have a lasting effect on people's mental health?
Yes, definitely, because everyone's going to be a lot more anxious with germs, like social distancing.
I think the impact of COVID-19 will impact on a lot of people's mental health, but it's also given a lot of people time to reevaluate their lives.
COVID-19 will have an impact on a lot of people's mental health afterwards. I think that it could have a good impact in the way that people are being more reaching out to people.
I think we're going to be dealing with the repercussions for the next 10 years unless there are drastic changes.
I do believe that following COVID that there will be an increase in the demand for mental health services and mental health nurses.
This is definitely going to have a massive impact in the long term on people's mental health.
The repercussions of COVID-19 will have an effect on people's mental health. I feel like it will also make everyone realise that it's real.
Coronavirus is going to make just generally the nation's mental health worse moving forward. I think people who've never struggled with mental health before will be experiencing it for the first time.
COVID-19 will have an impact on several people I know with what's happened to them.
There will be that period of time where people don't know what's happening, whether it's safe or not.
I think it could have a lasting effect on some people, but if they are struggling, seeking support could massively help them get through this difficult time.
Repercussions of COVID-19 will have a lasting effect on people's mental health because we've spent literally 3 months indoors, cutting all our routines down.
May lead to depression and other mental health issues.
I don't think it will go back to normal after this COVID-19 when it's over, whenever that may be.
100%. And it's not just my age group. I'm 61 going on 62. It's not me. It's going to affect young people.
So what have I found out from these interviews?
That many people have suffered and that many people will suffer. But with Come Together, there has been support and people are adapting to the situation, but there needs to be more done.